start the recording. Tolerances. And today's speaker is Dr. Bastidas. Dr. Bastidas is a graduate of Texas Chiropractic College. He graduated in 1998. He is the founder of True Lifelong Wellness Center. He has recently been named International Ambassador for the College of Integrative Medicine. He's an expert in using laboratory analysis and enzyme nutrition as part of a functional and natural approach to well-being. Clinical studies, the effects of nutrition and enzyme therapy on gastrointestinal dysfunction in 2014, and the effect of TPP protease on inflammation in 2012. His current focus is on developing specific treatment protocols depending on the biochemical individuality of the patient. His mission is to help patients achieve and maintain optimal health through a holistic and integrative approach. He strives to help his patients regain their health by educating them on how to obtain true lifelong wellness through natural means with the aid of nutrition and enzymes. I'm happy to introduce Dr. Bastidas.
Thank you, Shelby. Wonderful introduction. So hello, everyone, and thank you for joining us. Like Shelby said, it's one of many webinar series that we're going to be hosting, and mostly it's for education to our public. There's a lot of things out there on the web. And so what I'm going to try to do is provide some solid evidence-based information so you folks at home can learn a little bit about health and wellness. So today's topic is food allergies and food intolerances. And if any of you guys know the difference, I see a lot of patients that come into my office and they say, well, I'm allergic to this, I'm allergic to that. And I try to keep away from those things, but I still feel like my health is dwindling. I still feel aches and pains. I still feel bloating. I still feel migraines. And let me tell you, an allergy is different from a food intolerance. A food intolerance is mostly an immune reaction, a hypersensitivity reaction that your body is putting forth whenever something comes into the system that it doesn't like, that your immune system is offended by, or it identifies as being an intruder. Very different from an allergy. So when you have allergies, for example, you're allergic to egg or you're allergic to shrimp, that's going to cause an acute immune reaction. However, if you have a food intolerance, it's not going to be so acute, but it's still going to give you some symptoms that you may not be able to put your finger on what food caused it, because they're not so immediate and they're not so aggressive like a true food allergy. So let's go dive a little bit into what the differences are. And we got to ask, is this an allergy or a hypersensitivity? A type 1 immune reaction to foods is mediated by an immunoglobulin called IgE. That is a true food allergy. Those are the patients that come in and they know that if they eat XYZ, example an egg or shellfish or peanuts, they blow up like a puffer fish. They go through anaphylactic shock. It's a medical emergency. They have to go straight into the ER because it's life-threatening. And that's a type 1. It's acute. Remember, right away, very aggressive. A type 2 immune reaction is not mediated by IgE, not mediated by immunoglobulin E. It's mediated mostly by other immunoglobulins, immunoglobulin A, M, G, so on and so forth. And I'm going to show you the difference between the two. So again, remember that type 1 mediated by immunoglobulin E, and if you could see my cursor here, IgE is immunoglobulin E. These type of reactions, like I said, are very acute and strong. They're highly symptomatic. It's a serious medical situation. It could be life or death, and it's emergency type of a condition. It's you can go into anaphylactic shock, so they have to go in and give you a epinephrine, adrenaline, any type of antihistaminic, aggressive antihistaminic, in order to bring down that acute inflammatory process. The type 2 is not mediated by IgE, immunoglobulin E. It's cell mediated by immunoglobulin G, immunoglobulin A, immunoglobulin M. It's usually delayed. It could be from 72 hours to weeks later. So this is what makes this type of a reaction unique, and this is what makes it hard to identify. I can't remember what I ate yesterday. I'm not going to remember what I ate a week ago. So nevertheless, this reaction is going to give you symptoms. It's generally tolerable symptoms, but still they're persistent, and it could become systemic with time. And I'm going to show you through a little video I have on how it can become systemic, meaning that it goes into your circulation and it creates an immune response at the circular level. The good thing about this is that it is reversible. Okay, we can reverse these as long as we're able to identify. The way to identify these things, in my office, I really don't see much of IgE, true food allergies, because you really don't need to do much to identify those. It's pretty cut and clear. You eat an egg and it blows you up and it sends you to the hospital. So that patients usually know what they cannot eat if it's a life-threatening situation. But the type 2, the IgG, IgA, IgM mediated hypersensitivity reactions, like I said, those are harder to identify, and you really need to do a blood test in order to identify these. The good thing is that the probabilities are in your favor. The type 1, it's usually 1 to 2% of the population. Type 2 is 90% of the population. So you also have to keep in mind that these type 2 hypersensitivity reactions can, with time, may trigger a true IgE-mediated type 1 immunoglobulin response, and it can become a true allergy. And a lot of times, if you do have an allergy, let's say you're allergic to pollen, ragweed, you're allergic to certain foods, a true food allergy or a true environmental allergy, those can be triggered by these type 2 hypersensitivity reactions. Okay, and most of hypersensitivity reactions are of the type 2, and they can trigger these type 1s that you may already have. So if during allergy season, if you have a lot of hidden underlying hypersensitivity reactions to certain foods or chemicals, that's going to trigger the type 1 to be intensified or more dominant during allergy season. If you're able to identify these type 2s and eliminate them, your type 1s, your seasonal allergies have been shown to alleviate all by themselves. Let's continue here. Now, how do we get into all this mess? Well, the thing is, got a little bit of Spanish in here. At birth, biochemicals, that means nutrients, enzymes, and DNA, are obtained through our mother's breast milk. No baby formula contains them. So what this is saying is, and I gotta thank Dr. Dickey Fuller for these next few slides, because she really put this into perspective. When you have a baby that is not fed breast milk and goes straight to formula, that infant does not have the enzymes necessary to break down the ingredients that the formula contains. So that puts that baby into a risk of these hypersensitivity reactions. This is where we get a baby with colic. This is where we get a baby with rash. This is get a baby who can't fall asleep, failure to thrive. This is where we have babies that are just upset at all times and cry at all times, and they have this abdominal distension. Constipation can also ensue. And that's for the reason being is that they only have enzymes that are able to digest mother's breast milk. And if you've taken a look at baby formulas and the ingredients they contain, a lot of them contain artificial colors, artificial sweeteners, and the baby just does not have the proper enzymes to break all that stuff down. So, toxicity builds up in the baby. Babies up to 18 months do not make digestive enzymes for formulas. Again, only for mother's breast milk. And that's important because if you're giving a baby a bunch of food, a bunch of ingredients in a formula that the baby's system cannot recognize, it will not be able to digest it, break it down. So it will create some toxicity. At 18 months, they can begin to properly break down carbohydrates. Okay, that's 18 months. I know a lot of moms that before the baby is 18 months, they're already giving them crackers, they're already giving them a lot of foods to chew on, and again, they do not have the ability to break that stuff down. So that's going to create those hypersensitivity reactions that we grew up to have. At 3 years old, they can properly utilize sugars because they now have better gut bacteria balance. So that's very important. Our gut, which is our digestive tract from the mouth to the anus, contains intestinal flora. It contains good bacteria. And that bacteria is important in order for us to break down a lot of the foods that we have. That gut bacteria, it has a plethora of functions, a few of them being it helps us create our neurotransmitters, it helps us create our B complex vitamins, it strengthens our immune system. So it has a lot of functions that we don't obtain through unnatural childbirth. So for example, the first set of bacteria, good intestinal flora that we obtain is through the birth canal of the mother. So when a woman has natural labor, natural birth, she's giving that baby good intestinal flora. But what if they have a C-section? Well, right off the bat, the baby is going to come out without having that very, very important intestinal flora that's going to populate their digestive tract. So that's very important to know. Children's digestive systems are not finished until they're out of puberty. So as you can see, there's a lot of maturing to do in the digestive system. And if you're already feeding since childbirth a baby that does not have a proper digestive tract filled with enzymes and intestinal flora to help digest all the foodstuffs that are given to them, they're gonna suffer. And I wanted to show you a little video here that I have, and this puts it into perspective. Now, what you're seeing here is your gut lining. These are your intestinal junctions. These are tight junctions. They need to be nice and tight because it's very selective and it's impermeable. It doesn't allow anything bigger than 5 kilodaltons in molecular size. Okay, so these small peptides, this is the lumen, this is the intestines, and these are the cells of the intestines. Now through here comes nutrients. So we eat. There's macromolecules, there are micromolecules, there's nutrients, there's, everything you put in your mouth is broken down by your digestive system. It's broken down by the enzymes necessary to break down fats, carbohydrates, and proteins. So what you're seeing here is peptides that have been fully broken down and food peptides that have not fully been broken down. So this tight junction allows the small nutrients to enter. Now down here you have the immune system, okay? And now 80% of your immune system lies in your gut. And that's important because your gut is the interface between the outside environment and the internal system. And we can't have toxins come into the circulation because then the immune system is going to get triggered to attack. So these tight junctions need to be nice and solid, okay? And this is what happens when we eat and there's integrity in the tight junctions. You see how the nutrients come in and the big stuff doesn't make it through? Now remember, the immune system is down here. If the immune system sees something bigger than these nutrients, it's going to think it's a parasite, a bacteria, a fungus, and it's going to create an immune reaction. Okay? That is important. Now, here's what happens when there is a destructive lining. The tight junctions are no longer have integrity. They're inflamed, they become porous, and now the little guys, but also the big macromolecules, the big undigested proteins also make it through the intestinal lining. Remember, down here is the immune system. If the immune system sees this huge protein coming in, it's going to think it's an intruder. It's not going to identify it as a food. It's going to identify it as an intruder like a parasite, a bacteria, a fungus, and it's going to create an immune reaction and it's going to attack. Okay, so we don't want that. And this is what it looks like. We have no integrity, it's swollen, it's porous, and now big undigested particles are coming through. And that could be a piece of chicken, a piece of egg, it could be a strawberry, a banana, it could be a food that's known to be healthy, but since it's not being broken down properly and the tight junctions are porous, it's coming in as big protein molecules, eliciting an immune reaction. Okay, and that's when the immune system turns on and we have a hypersensitivity or an intolerance to certain foods. And this right here, this picture here illustrates what I'm talking about. We're going to use gluten as an example. Okay, if you can see here, these are sugars. Okay, and it's 500 Daltons. That's a small nutrient that comes in and there's no immune reaction. Anything bigger than 5 kilodaltons, 5,000 Daltons, will set off an immune reaction. Okay, so anything from 5 kilodaltons lower in molecular size, your immune system recognizes it as a nutrient and it will not elicit an immune response to attack. But if anything makes it into the circulation that's bigger than 5 kilodaltons, for example, the gluten protein is 80 kilodaltons in size. The gluten peptide is 6 kilodaltons in size. Lipopolysaccharides are secretions from bacteria, from the cell wall of bacteria, and that also makes it through the intestinal lining. But seeing that it's big protein molecules that enter into the circulation, that will trigger an immune response. Okay, and that is where the enzymes come into play. The enzymes will break all this stuff down and it will help maintain the intestinal lining integrity. Possible symptoms that you may experience from these pathological intestinal lining and macromolecules, undigested proteins making it into the circulation. It could be bloating, gas, indigestion, gastritis, reflux. You could suffer from constipation, diarrhea, migraines, headaches, myofascial pain, muscle spasms, joint pain, stiffness, chronic fatigue, low energy, low stamina, poor memory, focus, concentration, insomnia, hair loss, brittle nails, slowed metabolism, inability to lose weight, recurrent infections, nasal congestion, and the list goes on and possibly lead to autoimmune disease. Because what happens is when those undigested protein molecules keep making it into the circulation, the immune system keeps making antibodies against that food particle. Now, a lot of times those food particles that the immune system is making an antibody against will have a molecular sequence similar to your own tissue. So now your immune system becomes dysregulated, out of control, and it starts identifying your own tissue as an intruder because of that molecular mimicry. And that is what leads to autoimmune disease. You know, if it tags your thyroid, we call that Hashimoto's thyroiditis or Graves'. If it creates antibodies against your joints, that's rheumatoid arthritis, et cetera, et cetera. But it's all an immune reaction taking place from inflammation. Now, how do we combat this here at True Lifelong Wellness? Well, first of all, we believe that food is the genesis of good health. When we start consuming a lot of artificial colors, artificial flavors, additives, preservatives, those are chemicals that your body does not recognize as nutrients. Those are chemicals that have been shown to elicit an immune response whenever you consume them on a daily basis. We have people that have never even eaten a real meal. If they're used to constantly eating breakfast, lunch, and dinner at fast food restaurants, they're not getting solid, dense, nutrient-dense foods. They're getting a lot of preservatives, chemicals. They're getting a lot of artificial flavors, and they're eliciting an immune response. Autoimmunity, obesity, diabetes, high blood pressure are at all-time highs here in the U.S. because of the standard American diet. So that's where we try to educate our patients into using food as their medicine. Now, you can either choose this or this. And this is important because food is information. You know, food is not just to fill your belly. It's not to get rid of those hunger pains. Food actually is filled with information. Now, that information could either be good or bad. If you choose natural, organic, whole foods, it's going to be packed with good information. It's going to be packed with nutrients, with vitamins, minerals, amino acids. And that information goes into your system and it interacts with your DNA. Now, within our genetic makeup, we have good genes and we have bad genes. We all have good genes and bad genes. I mean, if cancer, if diabetes, if high blood pressure, if autoimmune disease runs in our family, we may have those bad genes within our DNA. But it's not the genes that make us up. It's the environment that we surround ourselves in that either turns on those bad genes or keeps them silent. That's why some people within the same family will develop an autoimmune disease and others won't, because it's about epigenetics, and epigenetics is how your environment affects the genes you have in your DNA. Again, it all starts with either good information you're feeding your DNA or bad information you're feeding your DNA. If you're feeding your DNA good information, your DNA responds and it thrives. It gives you good health. If you're constantly feeding your body bad ingredients, a lot of sugar, causing an insulin response, that causes inflammation. Okay, that inflammation will trigger those bad genes in your DNA to turn on. And you're now more susceptible to develop whatever hereditary disease you have in your family. So food is information. Just remember that. I try to educate my patients on that. It's very important. Food is information. It's not just to fill your belly and kill your hunger pains. Food brings important information to your DNA, and your DNA responds accordingly. Now, it could be, again, good information or bad information. Good information allows you to have good health. Bad information creates an immune response. It creates toxicity. That toxicity leads to inflammation, and that inflammation will eventually turn on those bad genes in our DNA. Now, here at True Lifelong Wellness, we have enzyme therapy, which we use to support our patients that are coming in with all these unidentified food intolerances. And like I said, these food intolerances are hard to identify because they're delayed. The reaction is delayed. It's not so acute or life-threatening, but still it gives you a persistent symptom, that you can't shake off, because what if you are intolerant or hypersensitive to strawberries, and you eat a strawberry but you don't get the reaction until a week later? Remember, these are delayed reactions that could go from 72 hours to a couple of weeks. So you eat a strawberry and you don't get the reaction till a week later. There's no way you're going to be able to identify, hey, you know what, it was that strawberry I ate a week ago that's causing me this. What if strawberry is your favorite thing to eat and you put it in everything? Well, that symptom, that expression of that intolerance or that hypersensitivity, if it comes by way of joint stiffness, you're going to be dealing with a lot of joint stiffness that is not going to react favorably to anti-inflammatory medication, or it's not going to react favorably to, therapy. Why? Because it's not really a structural problem, it's more of a systemic problem. That strawberry is causing a hypersensitivity reaction, an immune response, creating inflammation, and that inflammation is expressing in the joints, and you're having joint stiffness, joint pain from an otherwise nutrient-dense food, such as a strawberry in our example, but it's giving you a reaction nonetheless. So this is where enzymes come into place. First of all, we need to identify it through a blood test. And second of all, we eliminate it, we eradicate it from your diet, and we start providing enzymes. And these enzymes are able to prevent those proteins to enter your circulation undigested. If you have enough enzymes in your body, you're going to break down all the carbohydrates. Carbohydrates are enzymes that hydrolyze carbohydrates. That's all your sugars, your starch, your fiber, fructose, galactose, sucrose. Those are different sugars. It digests all the carbohydrates in cruciferous vegetables, the legumes, and the lactose. Digests starch in whole grain, cereals, pasta, rice. Digests all the fiber in fruits, vegetables, and grains. So by way of enzyme therapy, we could use, it's a great tool to use in order to prevent that immune response. Other enzymes that we provide are proteases. Now, there's different type of enzymes. There's carbohydrases, which we just saw. There's proteases, and there's lipases. The carbohydrases that we just saw breaks down carbohydrates. The proteases breaks down proteins. It hydrolyzes peptides and amino acids. Digests all proteins in a diet. It has fibrinolytic action, improves blood rheology, so it thins the blood, it cleans the blood, it rids it of toxicity, it modulates the immune system and can be an anti-inflammatory agent. Why? Because a lot of inflammation is there are proteins that are made by your immune system to attack. So if you have a lot of those pro-inflammatory proteins circulating in your system, that's going to cause pain. Things such as cytokines, interleukin-1/6, interleukin-1 beta, TNF-alpha. Those are pro-inflammatory proteins. And these proteases, they see those pro-inflammatory proteins created by your immune system, and they hydrolyze those proteins and breaks it down into its peptides and amino acids. So now that pro-inflammatory protein has been dissolved, and inflammation is thereby reduced. The lipases hydrolyze triglycerides to mono and diglycerides and glycerides and fatty acids. It digests all your dietary fats and vegetable / animal fats. Probiotics, remember I mentioned probiotics in the beginning. This is good bacteria. It's intestinal flora. The first strains that we acquire is from natural childbirth, because the mother's birth canal is packed with good, healthy intestinal flora. So when we come out of our mother's womb by natural childbirth, we are inundated by that good gut bacteria, and that's our first that's our first direct contact with that good bacteria. Remember, if we have C-section, we're going to be bypassing that birth canal, and we're going to have a baby that's going to be compromised and not have its intestinal flora that it needs. And this is just a few of the things that these good gut bacteria the few benefits that it has for us. It brings balance to the intestinal pH. It improves or prevents irritable bowel syndrome, stops diarrhea, alleviates constipation by regulating peristalsis, that's your bowel movement, reduces intestinal inflammation, increases mineral absorption, minimizes or eliminates lactose intolerance, helps digest proteins, produces essential fatty acids and short-chain fatty acids. Short-chain fatty acids are the energy fuel to your colon. People with colorectal cancer have shown to have little to none short-chain fatty acids. And remember, your gut flora, your intestinal bacteria, that produces these short-chain fatty acids, so you can have good colon health. And this also helps with metabolism. Again, this is just a few. It has like 100,000 benefits to the human body. So within our protocol, we support with enzymes and probiotics, along with identifying and eliminating the triggers brought by the foods that we're eating on a daily basis that are causing that hypersensitivity reaction. I always like to tell my patients, you know, prevention is better than the cure. Once you let this go out of hand, it can become systemic, and the symptoms that we read off in the beginning are enormous. Those are just a few of the symptoms that you can experience by having these hypersensitivity reactions to all these foods, and they're cumulative. So let's say you have a strong hypersensitivity reaction to 10, 15, and you know that's not uncommon. Whenever I run these blood tests for these food intolerances, I don't just see one. I've never had a patient that comes in, I do the test, and they only have one food intolerance. Never. I have never had one. Every patient that comes in has 10, 15, some even have up to 20 food intolerances, meaning that, you know, they're reacting against apples or oranges or the chemicals in the foods or the additives or the coloring, the artificial colors. That is a given. Every time I see a patient and I'm going to run this test, I know for a fact, without even getting the results back, that they're going to come back positive for a strong reaction to a chemical in the food or a coloring. It always comes back positive. I've never had a patient that comes back and their test shows that they have no reaction against colors, dyes, additives, preservatives, chemicals in their foods, chemicals in their water. It's always identified. So again, these are cumulative. So if you have an immune reaction to one food, it's going to give you possible symptoms. If you have hypersensitivity reactions to 10 foods, that's going to be cumulative. You're going to have 10 times the symptoms. You're going to have 10 times the woes, the worries. You're going to have 10 times the intensity. So this all accumulates because it's all about the toxic burden that you're putting on your immune system. You know, your immune system is like a dump truck. The more rocks you put on that dump truck, the more load you put on it, the heavier it's going to get, and the slower and the more challenge that truck is going to have to move. Same thing with your immune system. The more toxicity, the more burden it has on itself, the more challenged it's going to be, and the more dysregulated and out of control it can become. And then when it becomes dysregulated and out of control, it starts creating antibodies against your own tissue. That's where autoimmunity comes in. Okay? In autoimmunity, autoimmune disease needs to have three criteria. One of them being the leaky gut, the porous intestinal junction that I showed you in the second video. That's called leaky gut. When the intestinal lining is no longer tight, it's porous, that's intestinal permeability. Okay? First of all, autoimmunity needs to have intestinal permeability. Second of all, it has to have a trigger. That trigger can be anything that elicits an immune reaction. Like, you know, it could be a parasite, a bacteria, a fungal overgrowth. It could be these allergies, these hypersensitivity reactions, anything that brings about inflammation. Okay, and then the third thing that is needed for an autoimmune disease is genetic predisposition, if it runs in your family, okay? And it doesn't have to be in your immediate family. It could be down the line. It could be down the chain. It could be a great-grandfather, you know, or a great-grandmother. And the possibility increases the more family members it has, and the more down the line the condition becomes prevalent, the more chances that you're going to have of developing that autoimmune condition. So intestinal permeability, a trigger by way of an immune reaction, and genetic predisposition. Those things set the stage for an autoimmune condition to develop in any of us. Okay, so this, I think, wraps up our webinar. Thank you very much for coming out and listening to this. If you were unable to stay for the whole thing, or if we're going to have this is being recorded, and we're going to send a link out to everyone who registered. I know there were some people there that weren't able to attend, so this link is going to be recorded and be sent out to everyone. I'm going to take a couple of questions here. I have a question here from Mary, and Mary is asking how much of the enzymes are needed if you do have sensitivity reactions. Well, Mary, it kind of depends on the severity of the symptom, and the only way we can find that out is through the testing. Every protocol that we give our patients is given by way of testing, because we're all different. So I do a blood test that checks for levels of inflammation. Okay, there's a marker, and this is going to be another webinar that we're going to have on inflammation, because it is the common denominator in everything that walks through my door. So CRP, a C-reactive protein, that's an inflammatory marker that we can see in a blood test. And the higher that marker is, the more inflammation the patient has. And the higher it is, the more enzymes, to be specific, the proteases, I have to dose in order to bring down that marker of inflammation. Okay, so to answer your question, the dosing depends on the severity of the condition and the blood test, how much inflammation the patient is carrying. Okay, we have another question from Joe. Joe wants to know what's the difference between an enzyme and a probiotic. Good question, Joe. I get a lot of this being asked. An enzyme, your pancreas makes enzymes, and enzymes, what they do is they break down and help digest all the foods you eat. Okay, we can also supplement those enzymes, because we find fungus that produce these enzymes, and they're cultured on vegetation. So what they do is they extract those enzymes and they capsule them, and they become supplemental enzymes. So we can supplement with those enzymes, and they're very stable. They work from your mouth to your anus, and whenever you take them you take them with meals, you want to make sure there's a broad spectrum enzyme product. So it could have lipases, carbohydrates, and proteases. And so an enzyme helps you with food digestion. Okay, it helps break down proteins and carbohydrates and fats. A probiotic is a bacteria. It's friendly bacteria that is part of our microbiome. Our microbiome is a millions, billions, trillions of bacteria that lie in our gut. Okay, and that's what I went over the previous slides, that have tremendous health benefits in terms of helping us create our B complex, our neurotransmitters, strengthens our immune systems, et cetera, et cetera. So to answer your question, Joe, the difference between an enzyme and a probiotic is an enzyme helps digest our foods, and a probiotic is healthy gut bacteria that we get from vegetation, and we can also supplement both. We can supplement the enzymes, and we can supplement the bacteria. We have another question, and the question comes from Lisa. How is your way of treatment different than seeing an allergist and getting allergy shots? Okay, remember that we differentiated between an allergy and a hypersensitivity reaction. An allergy is an immunoglobulin E. It's a different type of reaction. Your immune system already created an antibody called immunoglobulin E, and that attacks those things that the person is allergic to, like pollen, ragweed, etc., etc. The hypersensitivity reactions are mediated by different immunoglobulins, immunoglobulin A, G, M, and those we are able to support with the enzymes, the probiotics, and eliminating, avoiding those foods that come in creating those hypersensitivity reactions. Okay, can I reverse, another question coming from Julie, can I reverse food allergies and eat what I want again? That's a $1 million question. Everybody wants to eat everything again. The lab recommends that when you have a strong food reaction, food intolerance, hypersensitivity reaction, it recommends you avoiding that food for at least 6 months. If it's a moderate food reaction, it recommends you avoid that food for about at least 3 months. After which you can slowly start reintroducing that food item to see if it gives you the same symptoms it used to give you before. I like to tell my patients, however, that if there is a hypersensitivity reaction to a strawberry or something that is a real food, then yes, you can start introducing that food back into your diet. But if it's an artificial color, artificial flavor, or a chemical or an additive, I tell my patients, try to eliminate that forever. I mean, we don't need those things. Our digestive tract doesn't recognize those things as being nutrients. So why want to reintroduce something that has red number 5 if you come back hypersensitive to red number 5? It doesn't make sense. Just don't consume it anymore. Okay. Another question: how long does it take to stop reacting to foods? Well, I think I just mentioned that. Strong reactions take about 6 months. If it's to a real food, if it's to a chemical, I recommend not reintroducing that. How often do I need to test for food sensitivities? You could do that depending on symptoms. If your symptoms are severe, hopefully by the first test we're able to bring down all that inflammation, all that reactivity, and we're able to improve symptoms enough to where you don't feel them anymore. Or if they're mild, you could retest in another 6 to 8 months. If we identify a lot of foods and you eliminate them and then you're still having the symptoms, then definitely retest in 6 months to see if you're still reacting to those foods or if those foods are still present in your diet. Because remember, you have to start reading labels, and which is another webinar we're going to have, is how to read labels. You have to start reading labels because a lot of these foods are hidden in packages, in boxes and cans, and you may not know you're consuming these things unless you learn how to read these labels. Okay, so I want to thank everybody for coming out and joining us. I hope this was informational and educational, and we are going to wrap it up. And thank you very much. Please visit us, our Facebook page, share us, like us, give us a call. Our number is 713-974-0300 if you want to make an appointment. Or write us at info@truelifelongwellness.com, and we will be happy to get back to you. So if there's any more questions, we will address them through email. I have a lot of these questions, but we're running out of time. So thank you very much, ladies and gentlemen, and hope to see you next time.